Hello everyone. Did you know that over 10 million people worldwide are living with Parkinson's disease? It may affect nearly 200 out of every 100,000 people. And as our population ages, these numbers are only expected to rise. I'm Dr. Deepti Vibha, Professor, Department of Neurology, All India Institute of Medical Sciences, New Delhi. But what exactly is Parkinson's disease? And how can we separate the myths from the facts? Let's take a closer look. Myth 1. Parkinson's disease affects only elderly. Not true. While it is more common after the age of 60 years, Parkinson's disease can occur earlier, especially when there is a genetic predisposition. In fact, anyone below 50 years of age with symptoms should seek evaluation. Myth 2. Tremors are the only symptom. Wrong again. Yes, tremors are common, but Parkinson's disease is much more than that. We can call it the 3S of Parkinson's disease. First S is slowness in movement, which is also called bradykinesia in medical terminology. The second S is shaking, what we also know as tremors. And the third S is stiffness in the muscles, which in medical terminology is called as rigidity. And the earliest signs may not even be physical. They might include loss of smell, constipation, depression, sleep-talking behavior, mood disorder, and so many others. So the first question is, how do we diagnose Parkinson's disease? There is no single test. A neurologist will make a diagnosis of Parkinson's disease based on clinical symptoms and a neurological examination. We might order scans in order to help to rule out other conditions, but Parkinson's disease remains primarily a clinical diagnosis. Next question is, how does the disease progress? Symptoms often start on one side, which may be in the form of shaking of a hand or a leg, and gradually involves both the sides. Over time, speech, expression, and thinking may also slow down. Can it be treated? Yes, but there is no permanent cure yet. In early stages, medications may help by replenishing dopamine, which is the brain chemical that is lacking in Parkinson's disease. Over time, higher doses may be needed and side effects can appear. In select cases, deep brain stimulation surgery or DBS can help in reducing symptoms when the medications start causing complications. But remember, it's not a cure. It is just a better control of the disease symptoms. Next question is, what lifestyle changes can help? So exercise is also an important medicine. Walking, dancing, and balance exercises improve symptoms, mobility, and even mood. Staying active is crucial. What are the side effects of medications that you need to know? Patients may experience sudden sleep episodes, which are called sleep attacks, involuntary movements during the onset of medication, which are also called dyskinesias, which are dance-like movements, wearing off effect, where the medicine works for a shorter duration as earlier. In rare cases, impulse control issues like gambling or overspending may also occur. In case that is happening, talk to your doctor, adjust doses, and that can help to manage these symptoms. Is Parkinson's disease hereditary? In most of the cases, no. However, if you have a family history or symptoms are occurring before the age of 40 years, genetic testing may be done to rule out familial causes or genetic causes. What if medicines don't work? In some conditions which may mimic Parkinson's disease, like multiple system atrophy or progressive supranuclear palsy, they do not respond much to the standard medications. Their management focuses more on physiotherapy and general symptomatic treatment and support. Let's bust the biggest myths right here. Not all tremors are Parkinson's disease. Not all Parkinsonism is Parkinson's disease. And most Parkinson's cases are not hereditary. Remember, early diagnosis and right treatment plan can help people living with Parkinson's lead an independent and fulfilling lives. Let's spread awareness, stay informed, and support people living with Parkinson's disease. Thank you. Namaskar.